Lindiwe, I know you've had a difficult time, but your little one is growing well.
With everything that I've gone through this past year, it makes me so happy to hear that.
I'm glad you called me to come and see you when you were feeling down.
I thought it would be easier with my second child, but it was so much harder. This baby was not planned and I wasn't ready. It felt different.
How were your feelings different with this child?
I felt close to my first child right from the beginning. It wasn't easy raising that child, but what gave me strength was seeing how much he needed me. With my second baby, it felt as if I was taking care of someone else's child. I remember one morning, after I finished washing and dressing her, I almost expected her real mother to come in and take her away. I felt empty inside.
Will you tell me more?
Nomsa, this feeling kept coming back until one night. When she wouldn't stop crying, I thought it might be better if someone would take her away. For weeks after, I couldn't sleep and my body ached. I thought the pain inside would never go away.
Sure, that must have been a struggle for you. And I remember you were worried about your baby too.
Yes, I think she felt my pain because it seemed like she cried all day and night. I didn't want to ask my sister-in-law to help me to take her to the clinic because I just didn't want to see her, even though I have always been close with her. I felt guilty because our home was so dirty, but I didn't have the strength to clean it. I was lazy.
Sisi, you needed the support.
I'm glad you were there, Nomsa. I didn't know what these feelings were or where to get help. You always knew the right questions to ask. I remember when I was pregnant and after the baby was born, you sometimes asked me those questions.
In the last 2 weeks, have you, on some or on most days, felt unable to stop worrying or thinking too much? Have you felt down, depressed, or hopeless? Have you had thoughts and plans to harm yourself or commit suicide? You said yes to the first 2 questions.
Yes, I did feel worried and hopeless for many weeks, but I never had thoughts or plans of harming myself or my baby.
Many mothers experience these feelings, but have trouble talking about them. We talked about how important it was for you to care for yourself. I helped you remember the activities that used to make you feel good inside, like singing in the church choir, and I also referred you to the clinic.
I was so scared when you first mentioned the clinic, but you went with me. That meant a lot to me, Nomsa. I never thought I would meet such kind people at the clinic.
Even though you were reluctant, I am glad that you listened to my advice and agreed that we speak together with your family about the pain you were feeling inside.
I'm so grateful for you for that. After I began speaking with her, I felt a kind of protection around me. I felt there were people there to help me through this difficult time, and things became better for me.
It was important to make sure you had the support you needed, and it was good to see your mother taking you to your next clinic visit.
Nomsa, what would you have done if I had said yes to your third question?
I would have referred you to the clinic urgently, Sisi. I would not have left you alone. You see, many women feel the way you did. For some, these feelings start even before the baby is born. For some mothers, the feelings of sadness are so strong that they consider hurting themselves or their babies. Becoming a mother can be hard for our bodies and our minds, so we must remember to care for the mother as much as we care for the child.
You reminded me of that every time you visit to check on me. As I spoke more with you and my family about my feelings, I began to feel better. Then one day, when my baby was almost 4 months, I remember feeding her, and in her eyes, I saw the reflection of a good, loving mother, and that mother was me.